Hello, everyone. I am Dr. Hope Watts, board certified family physician, speaker, health coach, and lifestyle expert. And today I would like to delve into what is the definition of obesity and what other things can obesity cause. Firstly, people often say, well, they don't want to use the O word. They just say I'm overweight, but in a lot of cases, they are obese, and we will get into how we make that determination. So, obesity is a very complex type of disorder. It, I used to think it was just people were just eating too much food, but that is not necessarily the case. Usually, there are other issues that can bring this about. And if obesity is unchecked, there are many health complications that can arise. Those may include, but not limited to, hypertension, high cholesterol, stroke, heart attack, some cancers, and diabetes. Obesity is a result of a combination of genetic factors, eating, lifestyle, environmental factors, and lack of exercise. So when you go to your doctor's office, they will say what your BMI is. And that is the doctor's way of determining whether you have obesity or you're just overweight or you have normal weight. The definition for obesity is a BMI over 30. Sometimes you don't even see it because it can be all automatically calculated your into the electronic medical record. So by all means, find out what your BMI is before you leave that office that day. What causes obesity in the first place? We've talked about a lot of different factors, and usually, in its very basic form, it just means that you are taking in too many calories and you are not exercising enough to burn up those calories. So if your favorite food is a Whopper, the large fries, and the drink, right then you've taken in more calories than you need for that whole day. And if you are not exercising, that food will be stored as fat. We like to call them love handles, but they're really fat handles. These foods are very high in fat, sugar, and cholesterol, known as, in other terms, as empty calories. Because you're eating all this food, but it has no nutritional value, but it has a detrimental effect of helping you gain weight. So risk factors, let's talk about reasons why people gain weight. Sometimes there's some genetic factors, and those factors sometimes we cannot change. Sometimes the amount of fat you gain is really determined by your genes. And sometimes we see families where everyone is obese there. And sometimes it's genes and sometimes it's some other reasons too. Genes can also play a role in how efficiently we burn up our calories. And I don't think we have really good indicators as to how that happens, but we've known for quite some time that that is the case. Genes can also play a role in our appetite also. Let's talk about some other things that can contribute to obesity. There are lifestyle choices that we make ourselves, and these are the ones that we can control ourselves. Sometimes an unhealthy diet. We've already talked about fast food and empty calories. I haven't seen too much supersizing lately because I think McDonald's has come under fire for that, but they get you in other ways by giving a 2-for-1 for like Big Macs, burgers, and things like that. In any case, you will be eating more calories than you really need for that day. Additionally, even if you supersize the drinks, you're getting more calories also. And as we said before, you will be taking in more calories. And the other problem is that a high fructose syrup is used in the majority of these drinks, and it has the ability to rev up your appetite and make you even hungrier than you really are. So a lot of times people are actually drinking more calories than they're really eating, but it all boils down to the same thing. Inactivity. So we've all been sheltered at home. Many of us are working at home. So we're in front of the computer, our tablets, the TV. Some of us are playing video games, or our children are playing video games. So we have fit the diagnosis or the characteristics for an A number one couch potato. And the more times you spend in front of these or doing these activities increases your likelihood of not burning up your calories. As I said in my other talk last week, a lot of times we're eating a lot of snack foods, or Doritos or chips, anything in a crackly, crunchy paper, and those things can increase our calorie intake. Also, it has been found recently that if you hang out with people who are obese or on the chubby side, you kind of take on the characteristics of the group. If you hang out with them, you probably go to the same places to eat. And sometimes people eat the same things in groups. So you may be inadvertently or unbeknownst to you eating a lot of extra calories. And this, I'm going to talk about another category that can make people gain weight, and that is medications. I was very pleasantly surprised, I should say, by one of my patients who brought me a list of medications, diabetic medications, that can help people gain weight. And I thanked her for it, but I realized that some of those medicines I was using may have helped her gain weight. So let's go about some other categories. Antidepressants, some, but not all, can cause weight gain. You'll need to talk with your doctor about that. Anti-seizure medicines. The one that comes to mind for me is Dilantin, and there are others that can cause weight gain also. Diabetic medicines, like I said. The one that really comes to mind is Actos, but not too many people are using that anymore because we have so many more medicines that actually help people lose weight. Antipsychotic medicines. Bipolar medicines comes to mind. A lot of them can cause weight gain, and so you need to, talk with your physician about that. Steroids. Oh, how many times have we had to use steroids for our patients? And they'll say, Dr. Watts, am I going to gain weight from this? And I'll say, no, if you just eat fruits and vegetables, you won't gain weight. And usually when I give steroids, it's only for a short period of time. Another culprit are the injectable ones. And some of our colleagues do inject joints with that. So if you are diabetic, you probably want to make sure you're not taking any extra steroids. Beta blockers have also been implicated in weight gain. Social reasons. In some places where people live, it's difficult to get out and walk. And there may not be places where you can walk indoors either. I've noticed recently, really in the last, I guess, 10, 15 years, that many of the malls have walking programs so that you can be walking in there safely, but everyone doesn't have access to that. Other things that may contribute, and these are social reasons, is how you learned how to cook. Something as simple as that. You may be putting too much salt in everything. Maybe you didn't realize there were other things you could use to flavor your food. Additionally, people often put fat back in their greens and vegetables, also to flavor it. And in addition, they're adding extra foods. Additionally, as we said before, if you have friends that are obese and you hang out with them, they know for sure that you are definitely going to take on their habits. And we have questions here on medications. Okay, she's just commenting on that. Yes, that's correct. Fatty foods to flavor foods with too much salt. That is correct. Another reason why people gain weight is age. As people get older, sometimes hormonal changes can create a situation where you don't eat as much and your activity is less. At some point, I read an article that actually says that women are at higher risk, especially after menopause. So if you're not as active and you're still eating the same amount of food, yes, you are going to gain more weight. You have to really be a little bit more conscientious about what you eat as you get older, because those same appetites, the food may still taste good, but your body is going to retain all that extra food. Other factors that can cause us to gain weight. Pregnancy is one of them. Now, sometimes, depending on the pregnancy, you can gain the weight of pregnancy and lose it right afterwards. But it just depends. You could have lost the weight with the first pregnancy, but the second pregnancy, it could linger and linger. And if you're eating a lot of these high calorie foods, yes, you can have problems losing weight. Another reason why people gain weight is smoking, quitting smoking. Everybody has a story about someone who quit smoking and they blew up. And that's because the person was very industrious in stopping their smoking, but they have started eating foods and they've never realized how good they tasted. So they're eating almost everything in sight. Additionally, some people who are smokers may have anxiety or depression problems, and some of them may be eating emotionally also. Other reasons that they have found for people to gain weight is lack of sleep. Not enough sleep can help you gain weight because when you wake up, something happens in your appetite hormones that revs up your appetite, and you just run for certain foods, and they have actually named them carbohydrates. And these could be simple carbohydrates and carbohydrates such as cakes, cookies, candies, chips, as we talked about the last time, give you a lot of empty calories, and you can find yourself just binging on these foods. Let's talk about another thing um, that can help people gain weight: stress. Simply put, we have a lot of stress in our society, and it can happen anywhere. I've had patients tell me, just driving increases stress. And so emotional issues can drive us to eat more foods than we really need to be eating. I've had patients tell me that they've eaten large bags of potato chips in one sitting, or whole cartons of ice cream in one sitting. So, why are we making such a big thing about obesity, or the O word? The problem is that obesity has a lot of complications, a lot of health complications. And people will say, every time I go to the doctor, he finds something wrong with me. That may be the case, but if you are carrying excess fat, because of this, you may be moving into the complications of obesity. And we will just delineate some of them right now. One particular consequence is high blood pressure. Many people don't want to take medicine for it, but that is one of the complications. Is it always related to obesity? No, it can be hereditary, but research has shown that high blood pressure can indeed lead to, obesity can indeed lead to high blood pressure. Another disease entity is heart disease and strokes. Usually it's high blood pressure, and then with the obesity, you can develop high cholesterol. And the obesity, high cholesterol, high blood pressure can lead to heart attack and stroke. Type 2 diabetes, a lot of people don't want to talk about that, but that obesity itself can lead to diabetes. The extra weight can prevent the insulin from working as efficiently as it should, and it can lead to obesity. Now, these diseases are not in a vacuum. There are other factors too, but for today, we are just talking about obesity. They have also found that certain cancers can be caused by obesity. Breast cancer, uterine cancer, colon cancer, ovarian cancer, and rectal cancer, just to name a few, have been associated with obesity. Stomach problems, usually heartburn, or some people call it GERD, is one of the symptoms of obesity, and one of the treatments is to lose weight. Also, we have some gynecological problems that are associated with obesity. PCOS is one of them. And as you know, and as some people know, that it can be a cause of infertility. In men, erectile dysfunction is related to obesity, and low testosterone levels are related to that also. Another condition that, and I'm not sure if a lot of people really know this, but sleep apnea, which is, I can't tell you how many people we diagnose with sleep apnea, is directly related to obesity. Yes, you have machines, but one of the treatments is losing weight. And this is a condition where people stop breathing off and on throughout the night. And it does have other complications that a lot of people aren't aware of, and that could cause sudden death. Arthritis. How many people have arthritis, and you see them hobbling around, but it is a direct result of obesity. The joints are only meant to really um, be able to take a certain amount of weight. And if you are uh, obese for a good portion of your life, the knee joints and the hip joints are the major joints that are affected and can cause lots of pain and discomfort and may lead to uh, surgery, such as knee replacement and hip replacements. So today, I have briefly discussed what obesity is in a small nutshell and some of the disease complications that you can definitely, maybe one, two, or more, um, start to develop as a result of obesity. Now, the next time we will talk about other ways to get around obesity so that you can be as healthy as possible. I am Dr. Hope Watts, board certified family physician, speaker, health coach, and lifestyle expert. Thank you for tuning in. And please follow me on Facebook, Instagram, Pinterest, LinkedIn, and Twitter. Do we have any comments here? We do have some comments here. Okay, I think we've commented on all the the things in the chat. So we will close down today and we'll see you next week.